Your back hurts, and there's one thing everybody knows you should do: panic. That's right, you should panic. No, I'm just kidding. You absolutely shouldn't panic. And in this video, I'm gonna share with you 4 things that you can check in on that are gonna give you a lot of calm about the back pain that you're having. And at the end of the video, I'm gonna even share some programs with you that you can do to give yourself the opportunity to start to feel better. I'm Dr. Pastuch, founder of Active Life, and I've been working with patients and clients since 2009 and 2005, respectively. Everything I'm going to teach you in this video is based on real-world experiences with real people that has worked. None of it is theoretical. Before I get into the details of the video, I know that some people don't like to stick around for the whole thing and you want the stuff up front.
But I want it now!
The 4 things that you're going to check in on are your stress, your diet, your sleep, and what you did yesterday. Let yesterday be a stand-in for last week, last month. What have you been doing recently that is maybe different or more than you're used to doing? Now, if you do stick around, we'll get into the detail on all of those and break down the programs that I think you can start doing right away to give you some relief. For this video, I want it to be really specific, so I'm going to use my computer for reference. Like right now, according to this study, there are 18 different categories for things that could be driving your back pain. They range from injury all the way to infection and cover everything in between. Each category has subcategories. The point of that is it's not always very clear where your back pain is actually coming from. That's why it's important that we avoid panicking when we start to feel it. It's possible, if not likely, that the back pain you're experiencing is coming from more than one of those 18 different categories. Then we have this article out of Yale New Haven Hospital, which touches on the complexity of nailing down exactly what's causing your pain because of the elements of biological, psychological, and social factors that can amplify or reduce the amount of pain that you're experiencing. I could go on all day finding sources that corroborate the fact that it's very difficult to figure out exactly why you're having back pain. But you don't really care that it's difficult to figure out why you're having back pain. You want to know how to get out of it. The reason why I shared all of that with you up front is because when you go online and you look for stuff like quick fix videos, exercises that you find on Instagram, even YouTubes that share full programs for your back pain that are completely dedicated just to that program, flexibility, mobility, strength, stamina, whatever they are, they're missing the context that there could be more than one thing that's causing your dysfunction. And doing those exercises that you see in those videos can make you worse, but more importantly than making you worse, because if that happened, you would just stop, they can lead to hopelessness and despair that someone told you that this is exactly what you need to do, but it didn't work for you, so you must be a lost cause. None of that is true, and I wanted to give you the context up front that if we don't know exactly what's causing the pain, we can't assume what intervention is going to solve it. I just wanted to give you peace of mind that the stuff you see out there that's this solves everything is nonsense. Most people have, or will have, or have had back pain.
I broke my back.
And like we discussed earlier, all those confounding factors make it very difficult to nail down exactly what it's coming from. What that leads to is having a really hard time using the scientific method to come up with ways to resolve it. I've even talked on Instagram about a New York Times article that was covering a meta-analysis of hundreds of studies that found that there is no one way to eliminate back pain that works really well. In fact, the best relief for low back pain came from things like chiropractic adjustments, physical therapy, and non-steroidal anti-inflammatories, over-the-counter medicine. And the best that they were going to reduce the back pain by was about 7%. The reason why I feel like all of that stuff is flawed is because it's really difficult for the scientific method to nail down exactly what's causing and therefore exactly what is relieving of the low back pain. We have to take into consideration all of the factors, and there's no study that's going to be able to do that with a definitive result, so no one's going to fund it. But I've been helping people with low back pain for over 20 years, and what I find is actually fairly inconvenient for me. It's that I'm less useful to my patients and my clients historically than any doctor or trainer would like to believe. That's the truth. Most people are not necessarily getting better as a result of the treatment or the exercise, but much more what's going on up here.
Yes, science!
Now, the trainer or the doctor can be influential in what's going on up here, and I'm going to help you with that right now. I'm going to have you check in on the 4 things I mentioned in the intro, and while finding out which one of them isn't going so well could be inconvenient for you, it doesn't change the reality that it also could be what's driving your back pain, and therefore could be the thing that, when remedied, resolves it. Let's start with your stress. This study of 8,473 people nationwide, and by the way, that study started with over 22,000 people, and they threw out people who weren't actually fitting the criteria for the study. So it's an extremely thorough study. Found that severe stress is correlated with a 280% increase in the likelihood of low back pain. 280%, all from stress. That's huge.
Huge.
Evaluate what's stressing you out right now. If you're feeling like you're at the end of your leash, things are just going absolutely wild, you're chasing your ass, that could be a huge contributing factor to why you're feeling low back pain. And while you're thinking, I need to get into a physical therapist or a chiropractor or an orthopedist or a neurologist or whatever, you might need to solve for your stress first. And thinking about getting to that appointment could be stressful for you as it is. So while I'm not giving you medical advice to avoid medical care, what I am giving you is advice to look for the area in your life that is driving most of your stress and find a way to overwhelm it so that your stress reduces. There's a likelihood that you're going to see less pain as a result.
You look a little stressed.
Oh, I'm stressed.
Next up is your diet. This study from NIH found that people with low back pain who eat a high-protein diet experience up to 21% less low back pain than the control group. And people eating a high-calorie dense, ultra-processed food diet have a 13% higher prevalence of low back pain than the control. Now, is that a double-blind study that says ultra-processed food causes low back pain, high-protein diet eliminates it?
No.
But that's a lot of correlation, and where there's a lot of correlation, there's often some causation. Or there is something that all the people doing that have in common. So if you find yourself eating less ultra-processed foods, it probably means you changed some other things about your life too. And any one of those things could have been what's driving the low back pain up from the normal person by about 13%. The same goes when you move to a high protein diet, reducing the low back pain by almost, 21%. That's crazy. Let's talk about your sleep. This meta-analysis found poor baseline sleep leads to worse pain outcomes with treatment, including the intensity of pain and the likelihood of long-term disability. What does that mean? As simply as we can put it, get your sleep. Ideally, and I know we don't live in an ideal world, you would go to bed and you would wake up when you wake up. No alarm clock. We do not live in that world. So what I want to encourage you to do is start going to bed earlier and earlier and earlier until you're waking up before you need to be waking up, and set your alarm clock for the time that you need to wake up in hopes that you won't even need it. But until you can get there, give yourself the best chance to make sure that you're hitting your floor of 6 hours of sleep. Give yourself the opportunity to get 8 or more. That's where I've anecdotally seen the best benefit for my patients and clients throughout the years of my businesses. And finally, what did you do yesterday? Remember, yesterday's a stand-in for over the last week or month. You could be adding more load into your system than your body is used to, and you finally crossed the threshold of causing you discomfort. Think about this like when you were in college going out to the bar drinking too much, because I know you don't do that anymore. You get drunk off the 20th shot. Well, maybe the 20th shot's where you black out. But whatever it is, it wasn't because of the 20th shot, it was because of all 20 shots. But the first one didn't cause the symptoms, the second one didn't cause the symptoms, the third one didn't cause the symptoms. But without them, there would be no 20th, which means that there would be no symptoms. I want you to evaluate if anything changed significantly over the last 30 days, even 60 days of your life, and especially yesterday. If you had a spike in your volume or the intensity of what you're taking on in your life, that absolutely could be contributing to your low back pain. And while you can't necessarily get rid of your low back pain right now because you just added that stuff and you got to recover from it, it can give you the peace of mind that this isn't necessarily a permanent problem. And the deloading could be your solution. It's no different than if you were doing a ton of squats in the gym and your knees were starting to hurt and you're like, it's obviously from too much squatting. Well, if you stopped squatting so much, the knee pain would start to go away. Or if you found better technique, the knee pain might start to go away. Or if you better balanced your accessory muscles, the knee pain might start to go away. If you're doing too much in your life, doing less is one option. Finding a better way to organize your life is another. Getting help with it is another. There's a lot of ways to go about it, but none of those ways have to include a surgery, a shot, an MRI, NSAIDs, a medical procedure, none of that. Again, not medical advice, not telling you to avoid the medical system. I'm just telling you that there might be alternatives that you can take on yourself. I mentioned an MRI briefly, and so I want to talk about it a little bit more. Until you have those things dialed in, I wouldn't recommend an MRI. In fact, I would recommend against an MRI if you were my patient, which you're not. I don't have a license. I don't practice anymore. I'm just speaking, high, whatever, from 10,000 feet. It's not medical advice. Again, not medical advice. There are exceptions to that rule. If you're feeling numbness, you're feeling tingling, you're feeling weakness, a doctor told you that you should get one, by all means, consider strongly an MRI. But if you're just dealing with insidious pain that came out of nowhere and isn't that severe, but it's annoying and it's concerning, it's going to be there forever, check those other 4 things first. And if you want to get an MRI, by all means, go ahead and do it. Just make sure that you watch the video that I already produced that talks about the benefits and the damages potentially with MRIs. Because I want you to be clear about what you find is not necessarily what you need to be acting on. I have one really strong rule for MRIs. One really strong rule. You are not allowed to become your diagnosis. If you're getting an MRI because you want to rule out ominous stuff like cancer, a broken bone, or a torn ligament, or whatever, something like that, by all means. If the MRI is going to guide medical treatment, do it. If the MRI is not going to guide medical treatment and you just want to confirm something like a disc bulge, a disc herniation, or something like that, and then you want to be able to walk around afterwards, or not want to, but you know that you probably would, walk around afterwards and say, I can't do that, I have a herniated disc, I have a disc bulge, I mean, whatever. You're not allowed to do that. You're not allowed to do that. MRIs do not give you that kind of information for you to have definitive evidence that that's why you can't do the thing. We've talked about that in previous videos. I'm disallowing you from doing that. Never become your imaging findings. Now let's get to the bonus. Key asterisk here. Throw an asterisk on the screen. Like a ding, there, that one. If you can tolerate these, you can try them. If you're not sure what I mean by tolerate, I would like you to go back and watch our video where we talk about whether you should continue moving forward or not after you finish this one. So we can link somewhere in the notes or on the screen, I think it just popped up on the screen, the video I made where I talked about how to know if you should move through pain or not. These 2 programs are so simple. And back in the day, I had programs that I would sell as templates that would help people get out of back pain when they were in a situation like maybe you are right now. The first workout I'm going to share with you is one of the favorite plank workouts that I took from one of our programs that we use to sell to help people get out of back pain from around the world. It's so simple. You're going to start by trying to do this for just 5 minutes at a time. And if in week 1 you're able to do 3 days, 5 minutes each day without any increase in your symptoms, week 2 you can increase by 20% to 6 minutes. You keep progressing like that until you can do 12 minutes straight with no symptom onset and no need to take a break. Start in a front plank on your elbows. Hold it for 15 seconds. Transition from the front plank to a plank on your left side. Hold it for 15 seconds. Transition back to a front plank. 15 seconds. Transition to your right. 15 seconds. You're going to keep rotating through those positions until you hit 5 minutes in your first week. And if you can't hold for 15, hold for less. Just keep the time consistent from each position and go for 5 minutes in your first week. In your second week, if you didn't have any discomfort your first, go to 6 minutes. In your third week, increase by 20%. You do the math. The second thing is stamina deadlifts. What is a stamina deadlift? I want you to maintain a tempo of pulling the bar up in 2 seconds, bringing the bar back to the ground in 2 to 3 seconds, and continuing to do that for 90 consecutive seconds. That's it. Give yourself a break of 2 minutes in between each set, and then go ahead and do it again. No more than 3 sets, no fewer than 1 set, all to tolerance. The weight should be a weight that by the end of the 90 seconds, you feel it's an RPE of about an 8 out of 10. That means you still have another, let's say, 20 to 30 seconds in the tank that you could do, but it's a little bit uncomfortable and you'd like to stop. So you do. I have to emphasize, this is not a heavy deadlift exercise for you. I cannot make it clear enough how hard this is going to be to do for 90 consecutive seconds. It might be an empty bar. It might be a kettlebell. It's just gonna be something that for you, by the end of 90 seconds, is an 8 out of 10 in terms of difficulty. I want you to start at a weight that is lighter than you think it should be by about 30%. So if you think you should start at 100 pounds, I want you to start at 70 instead. I would way rather you start cautiously than that you start aggressively. You're breathing while you're doing these. Just breathe. What we've seen is that people who shy away from deadlifts because they're afraid it's going to hurt their back are lacking the stamina to do them over the duration of a program that they are in, and that's what leads to the discomfort. They don't spend enough time focusing on the tempo at the lightweight, building the stamina in their musculature, in their joints, to be able to endure the program. You will. Recap. 4 things we're going to be looking at if your back is bothering you and you want to stay active before you take on any medical intervention, provided that you feel that's safe. First, stress. Second, diet. Third, sleep. We went over all the evidence of how all of those different things can impact your likelihood of having low back pain, the intensity of it, and the length of it. The last thing that we're going to be looking at, the 4th thing, is what did you do yesterday, 30 days ago, 60 days ago? Are you putting too much load onto your system that it's causing you the discomfort? If you're feeling like you're less than a 4 out of 10 for discomfort and you're ready to try some interventions, I gave you 2 programs to do. The 2 workouts are the plank variations and the stamina deadlifts. If you like this video, you found it helpful, please make sure to like it, share the channel, and subscribe to it. As always, I'm Dr. Pastuch. Live more, hurt less. It's a choice.